All right, I am here to start our conversation about Unit 2. So, Unit 2 is all about the administration of medications, and in this first video, I want to talk a little bit about drug names. So, so drugs have a whole bunch of different names, and this can be a little bit confusing. So what I want to do is I want to outline the names, the different names given for a drug, and then kind of talk about the logic around which name to use, whether you're going to use the generic name or the trade/brand name. And then I want to finish up with explaining the concept of a therapeutic equivalent. So when we start with names, so every drug is going to have multiple choices for names. One would be the chemical name. The chemical name is actually the exact chemical composition of a drug. So I'm going to use the same example throughout our different types of names. So I'm not even going to make an attempt to read that name to you. That's a chemical formula. That's the name, chemical composition of a drug. This drug is tetracycline. So that's probably not going to be the one we're going to use, right? Because it's just way too hard to remember and nearly impossible. Well, I should say way too hard to say and nearly impossible to remember. So another option would be the official name. The official name is the name of the drug listed in the United States Pharmacopoeia / National Formulary, which is the only official drug reference text in the United States. So the official name is going to be the name given to that drug and reference in that text. And I just said this, but the National Formulary was combined in 1974 with the USP, and so now it's one official text. So the official name for tetracycline is tetracycline hydrochloride. So that's the official name. Then we've got the generic name. The generic name is the name that gets handed down with the drug, and the generic name is the name that's, with newer drugs, the generic name is the name that's given to the drug during the testing phase based on its chemical name. You can see there's a committee, like ever, there's a committee for everything, right? There's a committee for naming drugs, which you don't need to remember. Once a drug is named and tested and approved, and if the drug is going to go to market, the generic name will become the official name if the drug is included in the USP. So essentially what I'm saying is once a drug is approved and listed in the USP, the generic name and the official name are going to be the same. So the generic name for tetracycline hydrochloride is the same as the official name for tetracycline hydrochloride. It's the same name. So really the generic name and the official name are the same once the drug is approved. Pardon me. If the drug has not yet been approved and it's still in the testing phase, then that would be the generic name. Okay, so before I talk about brand name, I want to introduce this concept of a therapeutic equivalent. So the therapeutic equivalent is not a generic. And the reason why I'm putting it in here is because sometimes it gets confused as a generic. A therapeutic equivalent can be a completely different drug. It's not a generic equivalent, right? Generic, in our previous unit, we said that once a drug is tested and approved and the patent expires, then any drug company can make that same drug based on the methodology that's outlined in the USP. So a therapeutic equivalent is not this. This is a different thing completely. The therapeutic equivalent is generally seen in a managed care kind of a setting, like a hospital, for example. And in these kinds of settings, the organization has a formulary that it works off of. And so essentially it has a list of drugs that can be used for certain therapeutic purposes. So for example, let's say you have an infection and it's been decided to, once the bug has been identified, then we choose an anti-infective agent that's effective against that particular bug. With the therapeutic equivalent, the antibiotic that's been selected, for example, might not be on the formulary, but they have another drug or drugs on their formulary for the same therapeutic use. And so the therapeutic equivalent can be substituted for the original drug that was prescribed if it's deemed to be a therapeutic equivalent. So again, I'm not saying this is a generic drug. I'm just saying that it's appropriate for the same therapeutic use, and therefore it's called a therapeutic equivalent. Now, the prescriber has the decision to stay in this kind of a setting that they would like the drug that they prescribe to be actually dispensed. And how that would be done is on the prescription. They would either check the box, no substitutions, or they would identify it by specifying dispense as written, which is what this abbreviation is here. So this is actually an advertisement, as you can see, for Valium, which is the brand name, which we haven't talked about. The official name for Valium is diazepam, official name / generic name. It's a benzodiazepam. So if you wanted to not have a substitution, you would have to indicate that by saying dispense as written. Okay, hopefully that makes sense to you. Again, if it doesn't, please ask. Here's another place that you could see this. So here, down here on the signatures lines, if you're okay with a substitution, you would sign here. If you wanted to dispense as written, you would sign here. And you can see in this particular prescription, you can kind of see these are prescription pads kind of layout, refills, DEA number, etc. But this is kind of what we're talking about here. I think that's good for that. Here's another place. So this is on our watermark form. Oops. And here is where it starts talking about a therapeutic equivalent. Okay. So back to names. The brand name / trade name, that's the same thing. Brand name, trade name, all the same thing. That's the drug. No, that's the drug company's copyrighted name for the drug. So there's only going to be one Valium, for example, right? There's lots of diazepams potentially, but only one Valium. The Valium is the trade name or the brand name, and that's a registered name given by the drug company. In that case, the drug company was Roche. Sometimes it's also called the proprietary name, and it goes with the drug company. The trade name can be renewed once the patent expires, but that name therefore will remain with that one company. Somebody else can't develop a generic and call it Valium. They could develop a generic and call it diazepam, but they can't call it Valium. That name is owned by the company, right? Remember, the patent will expire, but the name will not. So again, that 17 years is kind of the magic number for the patent expiration. And once the patent expires, remember, then anyone can make the drug, and they can just make it based on the same procedures that the original drug company made and the drug was approved for. At that point, they can call it whatever they like. In most cases, they just call it diazepam, or they just give it the generic name, right? There isn't any real big benefit in giving it a brand name because it's going to be at that point known as the generic. So here are some other, going back to our tetracycline example. So the official / generic name for tetracycline hydrochloride we looked at the chemical name. So these are different drug companies that are making tetracycline hydrochloride, and they're calling it, and the brand names are given there, or the trade names or the proprietary names. So tetracin, acromycin, cymicin, those are all tetracycline hydrochloride made by different drug companies and branded by different drug companies. So when we're in this conversation around generics, if you recall, I said that a drug company can make a generic. Once the patent expires, they can make a generic. And what has to be the same is all the active ingredients. What can be different are the inactive ingredients. And so those are like the binders, the fillers, the dyes, those kinds of things. Those things are deemed inactive, and those can be variable from generic to generic. And sometimes this actually happens with some degree of frequency. So let's have a scenario where you're going into the pharmacy to get your Valium, and the patent has expired. The prescriber has prescribed the Valium, and the pharmacist could say, oh, there's a generic for this. Would you like the generic? And in most cases, the generic is significantly cheaper. And so in most cases, people would ask, maybe they might say, is it the same drug? And the pharmacist would say, yeah, the active ingredients are the same, but the inactive ingredients are different, or they may or may not say that, but that's the fact of the matter. And then the patient can select, provided that the prescriber was okay or didn't specify dispense as written. And the patient then has the ability to select the generic if they want to. And in some cases, that's fine and everything works great. But in other cases, sometimes the efficacy is different. And the reason that might be the case is because with these binders and fillers and glues and dyes, etc., sometimes that can alter the bioavailability of the drug. Remember that term bioavailability, we've seen it a few times now. The bioavailability refers to the amount of active drug that's available to hit the target. So if for some reason a chemically equivalent drug bioavailability is altered by the presence or absence of some of these other inactive ingredients, that can actually change the bioavailability. Sometimes it's patient-to-patient variation. Like sometimes somebody might have something there might be something in the inactive ingredient that the person is allergic to, which is not uncommon with a lot of the binders and the fillers and the glues and the gums and those kinds of things, in which case the drug would not be as effective, or they might have some other strange symptoms as a result of that. So I like to mention that because it's something that comes up from time to time, and it's good to know that the bioavailability of a generic may be different from a brand name based on these inactive ingredients that are there. The active ingredients have to be equivalent, but the inactive ingredients can be different. Okay, so what name is the best one to use? Most people would agree that the generic and or the official name is the best one to use because it's usually the most familiar. The chemical name, obviously that's not the best one to use because that's just way too difficult to remember. And the brand names, yeah, you can use if you are trying to get a specific drug for whatever reason that might be. Then you want to use the brand name, and you would want to specify at that point that you don't want to substitute it, right? That you want it to be dispensed as written. But in most cases, once a patent expires then the drug will be referred to by the majority of the people by the generic/official name. Okay, so here's a couple examples of, and you can kind of see why this is reasonable. So we have 3 generic drugs: aspirin, diphenhydramine, and ibuprofen. These are all over-the-counter agents, although sometimes they are also found in prescription products as well. But you can see let's just look at aspirin, for example. So we have aspirin as the generic drug, that's generic name. And then you can see all kinds of different names for aspirin, right? These are all different brands of aspirin, but they're all aspirin, right? So if you just say aspirin, it's a lot more relatable for most people than if you were to say, like some of us are familiar with Anacin or Bayer or Bufferin, but lots of us aren't as familiar with Aspergum or Ecotrin or Imperin, and so just using that name doesn't always tell people what drug you're talking about. Whereas if you just say aspirin, most people would be able to go, oh yeah, now I know what aspirin is. So it's just a lot easier to keep straight, I believe, is probably the easiest way to think about that. Okay, so in this video, we went over the naming of drugs. So the options are generic, which is the chemical composition, chemical, which is the chemical composition, generic, which is the name given to the drug when it starts to be tested, and if it's approved and incorporated into the USP, that generic name will become the official name. The proprietary name, the brand name, the trade name, those are all the same, and those are going to be owned, if you will, property of, trademarked and named by the drug company, and that name is going to be unique based on that drug company's work. Hopefully that makes sense. And then the other thing that I wanted to outline is that once a drug is approved and the patent expires, then any other drug company can make that drug, and they're going to call it the generic name. They may give it a brand name as well, but they're going to call it the generic name. All generic names are going to be the same. So tetracycline hydrochloride, whether it's made by Squibb, Roche, whoever makes it, the generic name is going to always be the same. The brand name can be different. And then the final thing that we talked about was a therapeutic equivalent, which is not the same thing as a generic. And this is where people get confused. A therapeutic equivalent can be a completely different drug, completely different class of drug, but it's useful for the same therapeutic purpose. So they share a therapeutic use, even though they're different mechanisms of actions potentially, but they can be used for the same purpose. So that's the deal with the therapeutic equivalent. And again, where you normally will see a therapeutic equivalent is in a situation where a company is a pharmacy is working off of a formulary, or a hospital is working off of a formulary, or a nursing home, or whatever kind of managed care setting is working off of a formulary. So that's about it for naming of drugs. We're going to come back and we'll talk some more about routes of administration in a little bit.